Thank you very much. It's a good room, quite filled up. I was not expecting so many people, so that is a good sign. We'll use this for... So, type of publication. Publication is the way we do communicate to the community, and even outside the community, what we're doing and what is our work, what our research is done. So it's as Mark said before, it's an extremely important matter. It's part of your life, even if you're not interested too much in the academic world. I think this is publishing is important for a surgeon and for a scientist in general. When we talk about primary scientifically literature, we can divide different kind of literature in primary, secondary, tertiary, and gray literature. That, as you will see, it doesn't mean that it's rubbish. It's different concept of gray literature. The primary literature is when you are doing a research and you want, or you or yourself or your group or a group of surgeons, and you want to send it to a journal. And these are journals that needs peer review. So there is somebody that will check your article, check your methodology, and will tell you if this is good or not for publishing. This is the most common part. And the result of your research are usually called paper, and they have a different format. Usually there is an abstract, there is a keywords, introduction, material, methods, result. Slight difference between the different kind of journal, but more or less you should have all this part in your manuscript, in your paper. And these are published in scholarly journal, you know, surgical endoscopy, anesthesiology, whatever you want. Some of them can be also then published as a monograph or a thesis or a dissertation or a conference paper, because some of the conference papers are peer-reviewed. How it works, usually you send a paper to the editor. Some journal, like surgical endoscopy, do have subject editor. Surgical endoscopy have two groups. I'm part of the European group and the American group. And if the subject editor or the editor consider that is good enough to be sent to an expert reviewer, it will send to a reviewer, and it will get back with some recommendation. And usually is either the subject editor or the editor journal decide if the recommendation are good or not. There are different kind of journal that have peer review. You can have a local journal in your mother tongue language, for instance. It can be regional, can be international. And now we have also open access, that is a different category of journal that they have also peer reviewed. And as you saw, how do we score the journal with the impact factor? I do not like impact factor at all. I think it's a totally incorrect way to judge a journal. And also for the open access that became more often with all internet information, I think impact factor is not the good way to judge if the journal is good or not, but we need to find a way to create it. Secondary literature, these are publications that do not come from you. They come from somebody else, okay? So it's not necessary that the author of the paper is the author of the publication of the data. It actually is used to summarize the data and to synthesize the knowledge that you have on the specific topic. And usually they're good anyway because they give you an overview of maybe what you want to have a research or a study of, or to familiarize yourself with some sort of information or a topic that you want to get informed. These are usually a review journal, monographic book, textbook, our secondary literature, handbook or manual. These are written in a scientific style, but sometimes they're written in a very, easy style, a very storytelling style. And they need references. References have to be precise and to be full. And they do not necessarily have formal reviews, although it's the reader itself that became a reviewer. Tertiary literature is basically our paper or work that are based on primary or secondary source, doesn't matter, that they are made for different audience. They're made for for audience that is outside the subject. This is very rarely, interest of surgeon, but usually, you have a short bibliography. You can write for Science magazine, newsletter, some textbook or encyclopedia. They do not really need references. You can put references on that, but it's mainly your own opinion based on the knowledge that you have on this topic, and the audience is usually completely different audience from your own self, your own group. Gray literature. I think this is a very misleading title or definition. Gray usually reflects something that is not really important, but that has everything to do. Gray literature is when you have a scientific paper where the information are very difficult to either are not published or are very difficult to be obtained. So the term gray does not mean that don't have scientific value. Some of them have a lot of scientific value, but a gray is also only because it's difficult to have the original access to this publication. And these are thesis and dissertation. Sometimes they're not really published for everybody. Technical report, journal that are published but in a very limited group of people. Abstract of conferences. After conferences, sometimes are published only in proceedings, and that is difficult to obtain. Some other time are published in journals, and that is a different matter. And then you have working paper, government papers, sometimes are difficult to be obtained as well. The form of a publication does not guide into the, classification into primary, secondary, tertiary literature. That is an important thing. A monograph, for instance, that present new ideas, a result of a scientific research, even very well performed, is not necessary, even if it's not have a formal reviewer, is reviewed by the number of people that read the book. So sometimes they have, a good scientific value. But if you have an article written in a science magazine, even if the person who wrote is a Nobel laureate, doesn't mean that it definitely has a scientific value. So this will count as a tertiary literature, even if the person who writes is important, because he will not give you a scientific method for his publication. Conference proceedings are primary literature if they are published and they are peer-reviewed. But if they're not peer-reviewed, they will become tertiary literature. So sometimes, doesn't necessarily the way you publish does actually will count for your classification in this field. Then we have internet publication, and that is this is really a gray area, because you can have very, very good information, scientifically supported, in a very, very unknown website, and then you can have a very well-designed website with a good name, with a good reputation, but they just publish rubbish. Or tertiary literature, so meaning that, it's just an opinion of the expert. So that is difficult, because when you go on the internet and you Google anything, you come out with a lot of information. And this is very difficult, especially because these are the main source of information for our patient. There is no regulation on that, and I think it would be impossible to regulate anything that will be in the internet. So there will be a word of caution, and probably society should actually put a word on this, and maybe to give some sort of ribbon, like the ribbon we have here for the badge, say, okay, this is high quality information or poor quality information. But it would be a massive work, and I don't know who is going to take over this. What about the journal article? What kind of article you can have in a scientific journal. You can have letters, you can have research notes, the real article, called also research article or original article. You have review article, and the review article can be just a narrative review. You can have a systematic review. You can have a meta-analysis. We'll go through this. We have a perspective, opinion, or commentary. These are very common now, especially in the area of online journal and open access journal. Data paper, that's are rarely presented in a surgical community. Video paper, very often. Now we have a lot of journals that just publish video of technique, or a subset of printed journal that just print video paper, and also you have book review. The letters, that not to be confused to the letter to the editor, there's just a comment to an article, are usually defined as a short description of some kind of research finding that you can have. And if they are accepted, are very rarely accepted, because they have to be something that is really breakthrough. It's for, something that is really give you, information of something extremely important. And they usually are rarely peer-reviewed, in a standard way. They usually are reviewed by the editor, and they're usually quite quick to be published, but are very rare published. The same you see for the case report. Very little journal now publish case report, unless something that is extremely important for the surgical community, so they need there to be information. And I'll show you an example of that. Research note. Once again, very few journals accept this kind of article, and just a short description of a current research that give you a result that is not as important as the letter to the journal, but still have some importance. Because, between letter and research notes are very similar. It's just the importance that the editor will give to this kind of journal. And these are the most, common publication that we like to publish in a journal. And the article required, a complete description of your research, and they need to have a specific design, from this abstract to the notes to the references and everything else. And of course, the paper will be based on the result of your study and the analysis and interpretation of those data of the study. And we'll talk about the study later on. A review article. The review article is not an original publication. You just accumulate a different article on the specific field, and then you perform either a literature review or a systematic review or meta-analysis. And the articles are usually very long, because you need to cover the field that you are describing. Some paper, they just want, a very summarized information on this topic, so they accept short review, but are very rare. These are quite common, usually the commentary and the perspective opinion. They're quite common recently, especially in the online journal. They do not really have, for me, this should be considered a tertiary literature. They don't really have a scientific value. It's basically like sort of editorial, just your perspective on the topic, and it depends from the journal. Very little, impact factor journal accept commentary on perspective. As I say, video paper became very common now that we have an online version of most of the journal. And they usually describe a new technique or a new technology. It's very, very common nowadays, but I have a lot of doubts. I don't have the time to talk about this. I have a lot of doubts of video paper, because video paper, the editing of a surgical procedure or of a procedure itself, can actually give a big misleading to the reader and to the viewer. So I have some doubts about the real value of a video paper. Book review, many journal, even important journal, have a section for book review. This can be a good option for you if you, at the beginning of your writing or academic career, it still counts as an article, and basically you have an analytic analysis of a new book that has been published recently. Coming back to the review article, there are three different kind of review article, as I said. We have a narrative review, which is less common accepted into the journal nowadays. It's basically, it gives you an overview, usually a very narrative form of review of the knowledge on this topic. So you get all the paper on this, and you give, you describe the result, but usually is a very narrative form. It's not really scientifically written, and are very rare accepted by the most important journal in the field. Systematic review, you get the data of a specific topic, and you try to answer a particular question on this topic. So you focus your interest on the result of the literature that present, and you focus it. The meta-analysis is basically a form of systematic review, but where you applied a statistically method in order to compare result from one study compared to another one in a systematic review. So compares and combine different published study, but you have two possible outcomes, and you use a statistically method to compare. In fact, in meta-analysis, usually you have a forest plot that is a way to describe differences between two possible approaches to one design. I will leave with this one because that is too much. Just coming back to the meta-analysis, as I say, is the statistical analysis that combine the result of different studies on a specific topic. And why is good meta-analysis? Because the result of a good meta-analysis can be generalized to a very large population. The data, can be used in a clinical practice most of the time if there is a very, very good meta-analysis. The problem with a meta-analysis is that the quality of a meta-analysis rely on the quality of the study that you have been used for the meta-analysis. So the hypothesis that you are testing with your meta-analysis is as strong as the published literature that you use for the meta-analysis is good. As I said, that's what I was going to say. So meta-analysis of several studies does not predict the result of a single good study. So the quality is important, okay? And this is one of the major limit. When you perform a systematic review or meta-analysis, now you should refer, I need to go back. You should refer to the preferred reporting item for systematic review or meta-analysis. They call the Prisma. Is a website you can actually find, and they give you a checklist of 27 items that they should be in the content for a systematic review, and they also give me a flowchart diagram in order to obtain and to select the study that you are going to use for your systematic review or a meta-analysis. So this is extremely important because now it's been defined, and in order to have a good scientifically valid meta-analysis, you should go through these items and you should go to this flowchart in order to avoid to waste your time and actually give a meta-analysis based on very poor paper that do not give you any good result. When we talk about article, of course, we need to think about the study that we want, original article I'm talking about now, the study that we can do in our clinical practice. And as you know, you have preclinical study that are usually have the aim of check for efficiency and security, and these are based on animal tests. Then you have a phase 1 study that is focused on the tolerance and efficacy of your therapy, and these usually are performed on healthy volunteer. that you are paid to, that usually is related to a pharmacological efficiency. So you take a small sample size and you see if it works. And then you will check also the dose-effect relationship, either in patient or in healthy volunteer. You're phase 3 and you just want to test if there is a therapeutical efficacy, then you need several hundred patients, and you also want to see if this treatment gives you some sort of side effect. And once again, you need a lot of patients. And then once you obtain these 3 phases, you go for the market authorization to be used. And then, of course, you have a phase 4 that actually is when you use on a large scale in a current practice. And then you can actually also study, in this case, a morbidity and mortality related in a larger sample size, and, of course, the quality of life, another factor. In the area of evidence-based medicine or surgery, if we want here, we do have 3 different kind of study that we can do. As I say, and this will give you the strongest evidence possible. In theory, a meta-analysis of randomized control studies, so a meta-analysis of only extremely high value study, is the best evidence-based medicine information that we can have. But especially in the field of surgery, performing meta-analysis or only randomized control study is extremely difficult. I'll give you an example. I'm preparing with the EAS a consensus conference on single-port surgery. And my topic was single-port colorectal surgery because that is one of my field of interest. And we analyze extensively the literature. We find out, having a very wide meshes research in PubMed and Embase, we did find that they came out with 700 papers, okay? But if we focus on only randomized control study, we found 6. So that's explained to you that this is surgery is a very difficult topic to find and to perform a meta-analysis or randomized control study. If we're lucky, we can find a randomized control study. But interesting enough, especially in the field of surgery, we do have very little randomized control study to work on. And the third kind of literature, that is the one that we have more often available in the literature, are these. The third one, non-randomized comparison, historical comparison, case series, or we do still have in surgery expert opinion. Am I running out of time, maybe? No, I do have some time. Because anyway, I have 45 minutes for table and figures. That is too much. So I think I can save up some of this. You should find and you should decide what kind of study that you want to perform according to what kind of question you want to ask or answer, sorry. So if you're looking for the prevalence, if you look for the prevalence of the study, you should make a cross-sectional study, meaning that you want to have a snapshot of what is going on in the literature or in this particular disease at a specific time. If you look for the incidence, you want to have an information of what is going on in a group of patients from time A to time B, okay? So if you want to answer a question regarding the risk, you should make a cohort study or a controlled randomized trial. If you want to look for the prognosis of this patient, you can do a cohort study or a controlled randomized study. If you want to have a look at the etiology of the disease, you should even go for a case control. And if you really want to see if a specific intervention, a specific procedure is effective, okay, you should go for a control trial, randomized or not. And but if you want to avoid any kind of casualty in your study, you should go for a controlled randomized trial. from a writing perspective, you can have a descriptive study. So it means that you really cannot draw any kind of conclusion from this study for relationship between one factor and another, but you just describe the distribution and the characteristic of the population that you've been studied and the result that you have. But you cannot say conclude. You cannot be sure that you're concluding something between the relationship between one thing and the other. Or you can actually have an analytic study that basically try to find a relationship between different factors. And then you can try to explain this kind of relationship, and you can draw some conclusion. So the descriptive study want to describe an health problem and determine the frequency, the distribution, the outcome, but they don't not do any kind of conclusion. The analytic study, they analyze the role of one or more factor that you want to study, and they try to get the cause of the treatment, and they may draw a conclusion. We can skip this one. What are the observational study? Observational study can be a case report, but more often a case series. You describe in your article what you have done on this specific disease or topic. You can also have case control study, but still is an observational study. It's not something that it's not an analytic one. You can actually describe a cross-sectional study. So you want to see it in a specific length of time, a snapshot of what is going on at this point of study. A cohort study, you can describe what's going on in a period of time, which is different. Okay. The case report and the cross-sectional study, of course, you don't compare with anything. You just describe what's going on in your series. When you do a case control or a cohort study, you can compare the two studies, okay, even if they're not randomized. So this is just to give you a visual effect. You know, when you have you want to describe what's happening in a specific length of time, you know, you can have a cross-sectional study, and it's just a snapshot of what you have. Or you can have a prospective cohort study, and you want to know from A to B in a prospective way what's going on. Or you can have a retrospective study or a case control study, so you analyze retrospectively, even if you collect the data in a prospective way. Nowadays, since we all have a computer, you have all a database, most of the studies present in the literature are retrospective, but with a prospective database, which is better to have a retrospective analysis, because retrospective analysis of your data will give you a lot of bias related to the fact that you're analyzing the data that you recall the data after you have done something. In a prospective database, still you have a bias of analyzing the data retrospectively, but it's better if you have a very rigorous description of your data. Case report. Nowadays, most of the journals do not accept case report. Even if you think that you have done something great, even something particular, very rarely analyzed. There are journals that are dedicated to case report, very low impact factor, but at least you have a place to put your case report. But unless it's something really major or something really unusual, definitely is a waste of time. You try to send, most of the papers nowadays stated no case report. Surgical endoscopy stop accepting case report for a long time. Surgical endoscopy is not going to accept any more video presentation. In any case, if you really want to submit a case report, there are guidelines in the literature, once again, that will give you information related to the case report, how to write and give you, guidelines for producing case report. This is a case of a breakthrough case report. That's, that will describing, the correlation between the use of drugs and phocomelia. So that was something that should be informed as quickly as possible, as many colleagues as possible, in order to get the possible relationship between drugs and abnormality. Case series, this is basically a report on a series of patients with an outcome of interest, but there is no control. So basically, you have done something to your patient, maybe a new technique, and you want to describe what happened, but there is no control. So scientific value of a case series is very limited. So once again, if you want to publish this in a very good journal, this should be really something new, something that has not been reported, and the aim is not to draw any conclusion at all. Once again, for case series, there are some guidelines that you can check out. There is a checklist of the things that you have to follow to produce case series. And these guidelines are you see there will be a website that will collect all the guidelines for each kind of study. They're very important because they've been developed in order to reduce the bias during the publication of a guideline. Case control study involves patients who have an outcome of an interest. So you've done something to the patient, and they are compared, patients that are without the same outcome. Of course, these are it's not a randomized control trial. You cannot really draw any conclusion, but definitely are better than a simple case series study. The cohort study in this cohort study, you identify two groups of patients, two cohorts of patients, one that received the treatment, the other one that did not receive the treatment. One that did one procedure in some way, and the other one did procedure in a different way. And once again, you cannot really draw any strong conclusion in this kind of study, as you should recall the data in at least a prospective way, but most of the articles present in the cohorts article in the literature are prospective database analyzed retrospectively. As I say, this is the most frequent type of report in the literature. In the surgical field, we do have very little randomized control study. And you should have at least two, but you can even have more of intervention that you produce. And of course, usually this one is an experience of a single group, or a single surgeon, or a single center. And of course, you cannot generalize your result. This is why this has a very low level of evidence, especially when they are retrospective. You can use the case series in order to give yourself an opinion of some specific treatment, and then to start a randomized controlled trial. But very little example of this. There are very little examples of case series that then turn up to be a randomized control study, because that's a very often presented. And of course, why we present case series? Because you have a very limited, you get the data after a period of follow-up. It's very quick to analyze a case series. It's very inexpensive. Okay. If it's something that is really innovative, that's give you, good information of a new technology, but the evidence can only be acquired, to be sure that this new technology or a new approach has benefit for the patient. You just need to have a randomized controlled trial. I will just skip this too. I just give you an example of a case control study, just because of the most common that we have. Subject with a disease under study, a subject without a disease under study. Then you can measure the exposure risk, and then you can make the comparison, but you don't draw any kind of conclusion. As I say, case control can be performed in a very short period of time, and can be useful if you have a very rare condition. If you have a very rare condition, if you want to randomize controlled trial, a very rare disease, it will be almost impossible, because it will take you so long. So that's the advantages of having a case control. But of course, you will have selection bias by the fact that you're comparing your study with your group of patients with somebody else in non-randomized way. And of course, the relationship, the conclusion will be very difficult to be drawn. Cohort study, as I said, there are two groups that are compared. Only one group is exposed to a risk or to a therapy or to a procedure, and the other group is not. And basically, you want just to observe in a period of time what's going to happen. And basically, if you do it in a prospective way, you will start the study only when you have the exposure to the effect, exposure to the drugs, the exposure to a surgery. Cohort study, retrospect cohort study are very rare and have no much sense to me. As I said, you do have guidelines for any kind of study that you want to perform. Now we have the Equator, that stands for Enhancing the Quality and the Transparency of Health Care Research, and basically is an international initiative that would like to improve the quality of the scientific paper regarding healthcare. And you can actually go to the you go to the website, and you will have a specific checklist and flow chart that you should follow in order to prepare your research and to prepare your manuscript. A randomized controlled trial, that's the highest evidence. As I said, unfortunately, they takes time, they takes money, they're very rarely used in surgery. And basically, you have a random allocation to people that need a clinical or one or many clinical intervention. One of these interventions is the standard, and you want to compare to a control. And the control can be different. It can be the standard practice. We're doing an operation in a certain way, and we compare to a new operation. Or you can actually give a placebo, so especially for drugs studies, or you can give no operation. This patient has been treated for a diverticular disease, and this patient has been just observed, or for gallstone, or just observation. And of course, these are the higher, the strongest evidence if the randomized controlled trial is well designed. They give you a quantitative and a comparative analysis and a comparison between two arms. And of course, they are very, very high level of evidence, but they are definitely more expensive and takes more time. Well, they can be prospective, comparative, unbiased, but I just leave it. I just go here once again. When you're performing a randomized controlled trial, you should go to the Concert 2010 statement that are update guidelines that will help you out to publish and to report the result of a randomized control study. As you can see, there is a checklist once again here, and then there is a flow chart in order to give you the idea. So in summary, this very, very complex exposition of the type of literature and the type of study that you can have is very important nowadays that you are reporting, to the guidelines that are available in the literature. As you can see, you have guidelines for randomized controlled trial. You have statement. You have guidelines for presenting a systematic review. You have guidelines for the case report. Each one are based on the highest evidence, is usually made by experts in the field. And nowadays, there are some journals that do require that you refer to these guidelines when you want to publish your article. So you need to have a knowledge of this. And I thank you very much.